It's like a
Yes.
symphony. Okay. You've
Okay.
got all these different sections of instruments, right? And they all need to work nicely and sound harmonious in order to make beautiful music. So it's kind of like, it's just like that. I'm not the only person who refers to the hormones as a symphony.
Hello, everyone. Welcome to 15 Between. I'm Shakira, and we're continuing our February series and talking about vaginal self-care and discussing ways in which we as women can be intentional when it comes to taking care of our vagina in a more holistic manner, especially as we age. So my guest today is Dr. Elizabeth Leister, or better yet, Dr. Liz. And Dr. Liz has been an OBGYN for over 30 years. And so I am honored to have her as today's guest. And I'm anxious to learn more about her. And I'm going to turn it over to her so that she can give us a little bit of more details about what it is that she does, what it is that she specializes in, and some of the things that she likes to do just for fun. So with that, Dr. Liz, if you can just go ahead and just tell us a little bit about yourself, we would greatly appreciate it.
Sure, absolutely. Well, as you mentioned, I'm board certified in OBGYN. However, I don't deliver babies anymore. I don't do the office gyno either at this point. I have a small medical practice, totally specialized and focused on hormonal imbalance. Mostly women in menopause and perimenopause. I take care of men as well. They're easy because they're just simpler than us from a hormonal standpoint. So it's fun. All right, but mostly focused on women, and I just love helping women feel their best. I am a newlywed. I got married about 4.5 years ago.
Oh,
Yes,
congratulations.
thank
Very
you.
nice.
So that's yeah, and we feel like newlyweds. It's a lot of fun. It's a lot of fun to be in a grown-up relationship. It's a good thing.
Yeah.
Uh, and I'm raising two boys. I have two sons in their early 20s, and that's really a gift as well. So I have a lot going on, all of which is enjoyable.
Okay. And so what are some of the things that you kind of like to do for fun? I saw like on your website that you had a chance to climb Mount Kilimanjaro. How-
Yes. Kilimanjaro.
Yeah,
Yes.
Kilimanjaro. I always struggle with that one. So
Yes, it was fantastic. And if anybody listening to this, if you think to yourself, wow, that would be neat. And if you go out hiking and you love to hike, you could do it. You absolutely could do it. It was just beautiful. Lots of you can't go by yourself. You have to go with the people who work there, who are
with a
just
guy, definitely, right?
fantastic, amazing people. And it was just really an amazing experience. I do love to hike. There's a lot of great hiking in Northern California where I live. I love to dance. I like to dance in any way, shape, or form. But most recently, my husband has taken it upon himself to learn how to dance Argentine tango,
Oh, nice.
which I had been doing for a few years before we met. So, and it's hats off to him because the men have a lot more. The leaders, doesn't have to be a man, but the person leading the dance has to direct all of the steps. So it's a lot of
Yep.
fun. I really love it. Let's see. I love reading. I always have a book on my nightstand. I have a book on my iPad, and I have an audio book. So wherever I am, I have a book nearby too. So lots of, yeah, those are the main
Yeah,
ones.
lots of fun stuff. So
Yeah.
yeah, you live a pretty fulfilled life there. So that's nice. Enjoyed
Yes.
hearing it. So, Dr. Liz, as a holistic doctor, what approach do you take when it comes to caring for your patients? Can you share that with us?
Yeah, absolutely. Generally speaking, of course, I view everything through a hormone lens.
Mhm.
Okay, so I'm always looking for hormonal imbalances. If people don't feel right, if they don't feel good energy, if they're doing all the right things, but they can't manage their weight effectively, there's something hormonal going on. All right, so that's kind of a starting place, the way I am looking at people when they're not feeling well, right? That's when they come to me. So
Gotcha.
what and I want people to keep in mind, and I talk with patients about this, but in addition to the hormone balancing, I can't just fix people's chemistry. People have to also be aware of moving their bodies, I don't necessarily use the word exercise, but they have to, we got to keep moving. That's been one of our
Yeah.
biggest challenges recently is we're just all less active
Yes.
with less activity going on in the world.
Mhm.
And also, of course, nutrition. So what we put into our bodies, right? Those are the building blocks that our body uses to make hormones. Okay. And I'm sure we'll have a chance to say more about that, but it's very, very important. And also spirit.
Mhm.
How are we happy? Are we fulfilled? These things actually have a hormonal influence because the brain is influenced by hormones. You know, we feel happier when we have enough estrogen, and we feel calm and not anxious when we have enough progesterone, and we feel confident when we have enough testosterone. So I love to look at things that way. But most importantly, I'm talking with people and working with people in as you're saying, holistic way, looking at all these different parts of life.
Yeah. Well, I'm glad you said move. I know you don't like to say exercise, but move your body. This is a conversation that I have with my mom all the time that I try to drive home to her. Are there certain medications that you believe in or support when it comes to living a healthy, more balanced life? Can you maybe cover some of that with us?
Yes, that's a very interesting way that you asked the question. I like that. What I will say is I'll use the word bioidentical when we're talking about hormone replenishment.
Okay.
So if we're lucky, we get older,
Mhm.
right? If we're
Yes. Yes.
okay. And as we get, yeah, as we get older, our hormone levels decline. And I'll just say, why would we be worried about replenishing those hormones in order to feel better, like if we don't feel good from those hormonal declines? But it's important for it to be, as I'm saying, bioidentical. That means it's the form of the hormone that our bodies used to make enough of.
Okay. Okay.
All
A
right.
form of
So
our.
these are, yeah, it really falls within a natural approach. Let's just see if I'm thinking, and then there are some basics. Vitamin D,
Mhm.
very important. As anybody over 20 years old who takes showers with soap is
Yeah.
not going to get enough vitamin D from sunlight. That's just not going to happen. And that's not to mention sunscreen. All of those things block the conversion of turning it into the active vitamin D. So I always recommend supplementing.
Okay.
But
And
yeah,
that doesn't matter where you live. I mean, you can be in a
not
sunny
really.
state such as California, and you still recommend
Yes.
it. Yes.
Yes. I had a practice in Southern California, and in 30 years, I've had two people who had a decent level of optimal is a level above 60,
Okay.
but they had levels in their 40s, which is not bad without any supplementation. They were both fitness trainers in Southern
Oh.
California, outdoors all day long, every day, sweating off their sunscreen. So, people should just supplement.
I
It
get
just helps everything. Higher levels of D give lower levels of everything. Cancer, heart disease, bone loss. Yeah, it's a good one.
okay. So let me ask you this question. I mean, despite what happens in our environment or things that's beyond our control, is balancing hormones, is it as complicated as we make it out to be? Is that something you can go into when it comes to?
Sure.
Yeah.
I mean, I love it so much that I'm going to tell you it's not complicated. We women, it's like a symphony. It's like
Yes.
a symphony. Okay. You've
Okay.
got all these different sections of instruments, right? And they all need to work nicely and sound harmonious in order to make beautiful music. So it's kind of like, it's just like that. I'm not the only person who refers to the hormones as a symphony. And it's just the very best analogy because when they're all working together, that's when we feel our best.
Feel our best. Yes. Just more energetic and just not as sluggish. Okay.
Correct. Clear brain,
Mhm.
our weights responding to our efforts. We're in decent moods. We're getting good sleep. All of that is part of good hormone balance.
Okay. So then, are there any easy wins as women that we can maybe um, take into account and practice right away? Like, there's so many questions I always see that are out there in terms of, do we sleep in our underwear? I mean, are there certain foods that we need to stay away from? I mean, what are some easy wins that we can take just as women to help with balancing some of our hormone?
Sure, absolutely. All right. So I love that question. It's an interesting question about sleeping with underwear or not. Of course, whatever gives a person the best night's sleep, that's what they should do. So I'm
That's
going to start there.
okay.
And if somebody's comfortable not sleeping with undies, that's going to do some very nice ventilation.
hmm
All right. If you think about the animal kingdom and you think about animals that walk around on four legs, that area of the body with, for us, the vaginal opening, the vulvar area, in a animal walking on four legs, that area gets some ventilation,
Oh,
right?
I've never heard that before. So you are the
See,
very first person that kind of brought
right?
that analogy home. I've never heard of that, but it makes perfect sense here. So,
Right. So here we are, we're standing up, not getting ventilation, wearing clothing that can be constricting.
yes,
100% for sure. If a woman's feeling any issues there, yes, try to give as much room to that area as possible without underwear as much as possible.
okay.
Yeah.
So let me go down a list here. What's your view on should women wear thongs or not?
Yeah. Over many, many years of trial and error and trying different brands, I have found, because I do like thong underwear, that's fine.
Yeah.
I mean, whatever women want that makes them feel good is fine by me. Okay, that's what I want. I want women to feel good. So
Okay.
let's just keep that in mind.
Uh-huh.
So, but I'm not saying one way or another. But if I ever have an irritation or a concern going on, then I will not usually be wearing that more um, close fitting undies.
Gotcha.
So I do a lot of alternating. I have them in two different, I have a basket. My underwear is in a basket in my
Mhm,
closet. And
mhm.
on one side are the thong undies, and the other side are all the whatever I can find that's cute, but more like a
Maybe-
bikini style,
Yeah,
like
or high cut or
regular.
something. Yeah, I gotcha.
Yeah, exactly. Exactly. I couldn't remember all the names. Thank you. That's what I meant. Yeah,
Okay. So what about soap in the vaginal area? Would you?
excellent.
Okay.
Generally, I'm advising against it.
Okay.
Generally speaking,
Mhm.
the vagina is self-cleaning.
Yeah. And and if I can share, I did go, I think maybe went like a week or so without using soap. And there wasn't a difference in terms of, an odor or anything like that, if I can be, you know, frank.
Right, right.
Yeah, so I didn't notice a difference. It was just, I think it was conceptually hard for me to kind of wrap my mind around and continue with it. So, but yeah, just a.
Yes. So what I do when I want to do some rinsing, since we're
Mhm.
sharing here, is I do that first.
Okay,
When I get in the shower, I do that first
okay,
before I soap up.
okay. Do some rinsing.
And then, yes. So, I mean, you can go like all the way up to the top of the thigh.
Mhm.
It's not that a little bit of soap getting in the area is going to be a major problem, but generally speaking, the vulva and the vagina, they don't need soap per se. All the
Gotcha.
scented products that are out there, I do often recommend to women to not use those.
Mhm.
Douching is okay. That's so funny. People don't talk about that a lot these days, but when I was in the office doing gynecology, we were talking about this all the time.
Mhm.
If a woman wants to do that, just water,
Mhm. Just water.
just
Yes.
yes. Even
Yeah.
vinegar, even the
Yeah.
other things that people think you should put in the water, you really don't need to, and
Yeah.
definitely not perfumed. That's somebody's idea of what things are supposed to smell like. So
Yeah. Okay. All
yeah.
right. Very, very, very good advice here. Okay. So, last two questions on this topic here. So, um, Can we get an idea as to what's considered like maybe a normal discharge for women, or how a vagina should smell? So as indicators that women should be aware of or look out for.
Got you. Got you. Okay. I appreciate how you're asking the question, because obviously there's no one way that
Yes,
this
it's
area
it's
should smell. All right.
yes. Mhm.
So generally speaking, so let me talk about color
Okay.
of discharge. So it's going to vary between whitish or yellowish based on the point in time during the menstrual cycle.
Mhm.
All right. So progesterone can make it look a little bit more towards a yellowish color. The smell, when there's something out of balance,
Yes.
there can be, for example, if a yeast infection is going on, it literally does smell somewhat yeasty,
Mhm.
more than normal. So a
Mhm.
woman needs to know her own body. She needs to know what things normally smell like when she's feeling fine, no itching, nothing special going on down there. Different amounts, the amount does vary for women who are having their menstrual cycle. The amount of discharge varies during the month.
Okay.
So again, it's a matter of not being shy to get to know our own bodies and know what's normal for our bodies. And one more imbalance can give a fishy smell.
Okay.
Okay, now
Okay.
this is a little hard to say because I think a lot of women feel that the usual smell is a little bit fishy.
Mhm.
All right. So again, a woman needs to get to know herself in order to then know if something is off. But usually that kind of vaginitis, as they refer to it, there was an overgrowth of certain bacteria and it gives that particular fishy smell.
Mhm.
It's usually it's a noticeable difference, and
Okay.
it's usually accompanied by other symptoms, itching or something else like that.
Dr. Liz, is there any bit of advice that you can give us, or maybe some parting words of wisdom that you would like to share before we get out of here?
Sure, sure. I would love to. I encourage people to get rid of what I call the J word, which is just. So
Oh,
if anybody tells you you just have to accept how you're feeling because they can't find anything wrong because they ran 2 tests, or if they tell you you're just getting older, no way. Circle a line through it. So get rid of the word just. Don't tolerate not feeling your best. Go seek out what you need, get what you need so that you can feel great, so you can do great in your life.
Yeah, and I love that, because that was once my journey when I was going through fibroids, when no one could find out, what was wrong with me, which I didn't understand why that was the case. But yes, I support, getting that second opinion. Don't listen to a just, this is just happening because you're aging or what have you.
Right.
I appreciate you taking the time out of your busy schedule to sit down here and have this conversation with me, talking about women's health, because it's a big uh, love of mine, especially with dealing with what I dealt with for so long when it came to fibroids. So this will always be my passion, and I'm glad that we both can share in that passion when it comes to women's health. So I thank you for taking the time.
You're welcome. My pleasure.
Okay.